course, here at Remar Review, we always do this little thing. It's called How to Pass NCLEX. If you are a nursing student trying to pass your NCLEX exam, taking your test tomorrow, your attention is required here. We're going to talk about some NCLEX questions. We are going to get into it. This is the most exciting time of the year for Remar Review. We got so much going on, but let me tell you about this. Look at this number, 75 YouTube subscribers. Yes, I'm so excited about this. All right, I'm so excited. We have 75,000 YouTube subscribers. That's incredible. But my goal is to get to 100,000. So can we take this number up to 100,000? If you are not a subscriber on YouTube, you got to get on there because I love popping up on YouTube. I love doing my my live events, my classes on the YouTube page. So head over to YouTube, smash that subscribe button so that we can get up to 100,000. I know we can do it. Today, you're going to be super excited because we are talking more NCLEX questions. Good afternoon. Come on in. I love my nurses from all over. Hello. We're doing NCLEX questions today. Also, our Monday motivation, having a bad day. If you think you're having a bad day, stick around, all my friends, because we are going to get into what is a bad day. All right. Oh, shout out to the virtual trainer nurses. Everybody that's studying the virtual trainer right now, I see you. You are doing amazingly, amazingly. I was in there this morning. The practice exams are challenging, but I see you guys taking them and retaking them if you have to. But the goal, again, is to get that 95% in the virtual trainer so that you're ready for your NCLEX exam. Yes, the virtual trainer is preparing the nursing students for their NCLEX exam, and we have 6,500. Oh, we have 6,500. Yes, nurses right now. I love that number. If you are not in that number, make your way over to the virtual trainer, remarnurse.com, and let's get studying together. Let's make this thing real. Let's make getting our nursing license real. I'm doing good. Baby Shiloh's doing good. We're back. And we're about to get into our NCLEX questions. Hello, Remar family, sisters and brothers. It's time to put on your thinking caps. I have some questions for you right now. Here's the first one. A nurse, it's live. Here we go. A nurse is starting her shift. She is giving report on 4 clients. Who should she see first? Number 1, a client who recently started tube feeding and has 3 loose stools in the last 5 hours. A client who has a recently inserted bladder catheter and who is apprehensive and reporting itching. 3, a client who recently had a thoracotomy and reporting pain at the insertion site. Or 4, a client who was recently diagnosed with systemic lupus erythematosus, reporting redness of the palm. Okay, so here we go. We have 4 clients. I see a lot of 3s. I see a lot of 3s. The client who had the thoracotomy. I see some 2s. The client who is apprehensive had the bladder catheter. All right. What else do we have going on? What are we thinking? I see 1, 4. Okay. Lupus. What do we know about lupus? All right. Lots of 3s, lots of 2s. We're divided today, but that's okay because at the end of this, we're going to have it all figured out. We're going to go over the rationales. The most important part is that you participate. Doesn't matter if you get it right or wrong, as long as you give it your best. All right. So let's reveal the answer in 3, 2, 1. Pow. Here it is. It is indeed number 2. It is indeed number 2. Did you catch that? Oh, did you catch that? What do we have going on here? You have a client with what? A latex product. Okay. A latex product who is now reporting itching. Should there be itching if you get a catheter inserted or an IV inserted or a stethoscope assessment? Should there be any kind of itching going on? No, there should not be. So if my client has something new inside of their body and they're having a response to it, I'm thinking they may be having a what? An allergic reaction. And allergic reactions for the NCLEX exam are mostly life-threatening. Okay. Very rarely do I see an NCLEX question where the allergic reaction is just like, it's got a little allergies. Usually it's like allergic response, get the what? What's the treatment for anaphylactic shock? What are we going to give for this? Because this patient should not be apprehensive. They should not be feeling any type of way. All right. Have you ever had a catheter put in before? There should be no changes in your hemodynamics at all. So what do we give for anaphylactic shock? I'm just looking for the answer really quickly. Put the answer in if you know it, so that I can say it. Yes. I see him scrolling up now on YouTube and Facebook. We're going to give epinephrine. Epinephrine over Benadryl, always on the NCLEX exam, always. Because Benadryl, people ask me why. Well, if you give Benadryl, it may or may not cover the specific allergic reaction. It may or may not decrease the symptoms of it, but epinephrine absolutely will. So, of course, in the hospitals, they do things a little different, but for your NCLEX exam, you want to go with epinephrine always, okay? All right, epi for number 2, possibly because this could be anaphylactic shock, which for priority questions, we are looking for the life-threatening situation. That's the one we always go to. And so, quick facts, shout out. Listen, shout out to quick facts, all right, for NCLEX. If you don't have it, get this book. It'll help you a million times. If you got this one wrong, a couple people did get this one wrong. They picked number 3, thoracotomy. Yes, you see thoracotomy and you think, well, that's the thoracic cavity. Hey, listen, this is respirations, this is breathing. You see that. But we have to look at what is the client reporting to, but that's not what we have here. We have the client is reporting what? A psychosocial condition. So they have pain at the insertion site. Pain is not going to be the priority. And yes, I like that. The pain is expected. So expected pain, unexpected itching. Which one do we go with? We got to go with the unexpected itching. All right. So that is the reason why 2 is 2. All right. That's the reason why 2 is the right answer here. And the other ones are like not life-threatening at all. You have somebody with a tube feed, which you guys know tube feeding is a liquid nutrition. And of course, you're going to have loose stools if you have a tube feed introduction. And then the client with the redness of the palms, that is going to be pretty common and expected with a patient with lupus. So let's do the next question. If you got it right or if you got it wrong, doesn't matter. This is practice. All right, we're practicing. All right, here's the next question. You're going to really like this. Warfare sodium. We're reading a label. All right. Warfare sodium 10 milligrams PO is ordered. How many tablets should the nurse give? All right. Write the answer down, or write numbers only. Write numbers only. Looking at this label. Hello. This is a low-key math problem, but it's also reading comprehension as well. You guys know for NCLEX, reading is half the battle. All right. Doing good, everybody. I'm so proud of you guys. Remar nurses are showing up, not afraid to take on the hard questions, huh? All right. That's what we're doing today. You made it live. I hope you caught me when I went live Saturday night. We had a good time. All right. We're doing the NCLEX questions. We're doing the hard work. We're having a great day here. We're having a great day here at Remar. Okay. All right. I am going to show the answer here. I am going to show the answer here. Trust in yourself. Trust in yourself, guys. I like that. You guys are giving some good advice here too. Loving the motivation. All right. The right answer in 3, 2, 1. Yes. Oh my goodness. Yes. So I have it down here in the rationales. It's kind of in the bottom. I don't know if you guys can see it. However, all right. The nurse is asking, the nurse has to, let me show you the question again. The nurse has to give 10 milligrams. The tablets are 2.5 milligrams. So we need to give 4 tablets. We need to give 4 tablets. And the rationale's at the bottom here. You just got to do some multiplication here or some division. You can divide 10 by 2.5. Or you can multiply 2.5 times 4 to get 10. All right. And that's how you answer that one. Woo! That would be considered an exhibit question on the NCLEX exam. You ever see an exhibit question on the NCLEX exam? They make you nervous. All right. They make you nervous. Okay. Let's do another question. We are moving right along, getting into this Monday motivation, into this how to pass NCLEX. You guys are doing really good, actually. All right. Question number 3. We in here. All right. A client was recently admitted with a fever and bronchitis. All right. The client was diagnosed with adenovirus. Which of the following is the appropriate isolation to initiate? Okay. Number 1 says droplet. Number 2, contact. Number 3, standard. Number 4, airborne. Here we go. Okay. Hey, if you're driving out there, be careful. Be careful. All right. Now, let's see. This is an isolation, question. I haven't done these in a long time. So I'd like to see what you guys know about isolation precautions. They're big on the NCLEX exam. They are big. You got to know this topic. All right. You got to know this topic. I see the answers rolling in. Okay, so you guys think it's droplet, huh? Okay, all right. There may be 1 or 2 out there that has a difference of opinion. You had a bunch of these on NCLEX, huh, Michael? All right, I believe it. These questions are tough. All right, the correct answer, I'm going to tell you guys. Simple. What I like about isolation questions is that these questions are a lot of memorization. They are not critical thinking. You just got to know that this is droplet. You got to have that thing memorized. All right. And so with droplet conditions, the way I like to think about droplet conditions is that they are usually the cold-like symptoms. So if your client has a fever or sore throat, a whooping cough, right. Like pneumonia, bronchitis, and then they result in things like diarrhea or pink eye. That is going to be droplet. Okay. And according to the CDC, which is where we get all of the information for isolation from, that needs to be your best friend. Hey, we're going to look at adenovirus and say this is droplet isolation precaution. Contact precaution, you guys know these are the precautions that are transmitted through touch, skin to skin. So a lot of your skin infections, somebody says, I have plenty of these on NCLEX. Yes. So a lot of your skin infections, you got MRSA, that is going to be a contact, right? You come in contact with them. A lot of the sexually transmitted diseases are contact precautions. So pubic lice, things like that. You got to come in contact with the person. I go over this in great detail in your virtual trainer. So if you have this book, you have gotten this section, then you know this information, okay? Virtual trainer, we lecture on this. I don't lecture on a lot of topics, but isolation and putting patients in the same room and separating them, you got to know that stuff for your exam, okay? So contact stuff. Yes, C. difficile. All right, good job. I like that. Airborne precautions. We do airborne. That was option number 4. For those that you can get respiratory wise. So what's airborne? We have TB. Give me some airborne precautions. TB, varicella. What else? TB, varicella, and the measles as well. Is there one that I missed? MRSA? No, MRSA's not airborne. I'm MRSA. I'm talking about MRSA. So it's the staph on the skin. MRSA's on the skin and on the nose. All right. So Mike says, I can't wait. Next 2 lessons. Okay, yeah, varicella. Meningitis is not airborne. A lot of people do think meningitis is airborne. Meningitis is actually what? What is meningitis? Herpes zoster is airborne. Okay. Meningitis is droplet. Yes. Meningitis is droplet. All right. Okay. So make sure you guys write that down if you did not know that. Okay. All right. All right. So listen, guys, let me tell you this. I love doing NCLEX questions with you. I will do them with you all day if I could. But this is what I need to say about it. I need you guys to sign up for my NCLEX list so that you guys know when I'm doing NCLEX questions. Like I said, go to the website, remarnurse.com, and sign up, because the news, the emails and the newsletters will tell you all the events that I'm doing for this season. You guys know we have a lot coming up. We have the party. We have Black Friday. We have 7 days of NCLEX. These are all events that are coming up. And the only way you're going to know about them is if I give you the notice. All right. So if you guys missed my Saturday study session, I give people notices when I'm doing NCLEX questions. So I really want you to go to remarnurse.com and sign up so that you know exactly what events we will be doing. All right. Because this is the time now where we really rev up our NCLEX reviews and our live sessions, because the end of the year is closing and we have to make sure you guys get your license before this year is out. So again, hey, remarnurse.com. Give me your email so that I can get in contact with you. All right. Also, the virtual trainer is still on sale. This is the program that I go over all of that needed to know content and help you guys. 3 months, I'm helping you. You get the workbook, the study calendar. You can, you will, you must pass. All right. 99.2% passing rate. All right. And I'm really proud of all the nurses who are studying right now with me. I love it. I love it. I love it. Now, also, what I want to say is the year is almost out. The year is almost out. Every day we put off studying. Every day we put off, oh, I'll do it later. I'll do it next week. Literally, I read that every day that you put something off, it sets you back 6 months. Right? So that is the time exchange. Can anybody agree with that? Like every day you say, I'm going to do this. And when you look up, 6 months have gone by. A year has gone by. Is that your experience at all? I really want to prevent that from happening at this year, at the end of this year. And there were people who took advantage of every opportunity that was presented them when it comes to studying for NCLEX. And so now I have to give my Remar Roses. Yes. All right. Remar Roses are given to those who have succeeded and gotten their license. And so the first nurse again is going to be, hello. She says, allow me to reintroduce myself. This is Tanisha Jones, LPN, AKA Nurse Jones. I like the way that sounds. She says, the journey was rough, but I did it. I accomplished my goal of a nurse before 30, a young lady. Huh? Okay. And more importantly, before 2021. And that's the goal for you guys. Before this year is up, she had some late nights. She had some tears, but at the end, it's all worth it because she's officially Nurse Jones and it feels so good. And she's on her way to get her RN. Listen, it doesn't matter where you start. It doesn't matter where you start. You guess where you finish. She says she's going to get her RN and then she wants to be a nurse practitioner. Tough job, tough job. All right. So congratulations to her. I want to celebrate you guys all. I'm doing that. And I want to thank Mark so much because he has the Remar Party is set up. And I'm so excited for the Remar Nurses. Our NCLEX party is coming 14 days away. Woo, that was fast. We have 10 slots left for those who will be joining us. If you pass with Remar, hey, you got to join the party. Sign up. If you pass with Remar, or you know your friend did and they told you about it, tell them to sign up. remarnurse.com/party. Also, if you want to attend, go ahead and sign up. We're going to do some cool things at that party. Even if you haven't passed, check it out. We're going to be doing some giveaways, some prizes. I love it. I love it. You guys know last time our last live event was cards. It was just a fun time. So we're going to be celebrating our Remar nurses and getting the scoop on what they're doing and how they prepared and everything that can help the Remar nurse community. So I'm excited about it. All right. 3 questions we did. If you want to do more questions, again, remarnurse.com and give me your email because I'm going live again. I'm going to go live again this week. And so I will send out an email when I'll be doing that to do more questions. We won't do anything but questions. Right now, I have my Monday motivation for you guys. Having a bad day. If you think you're having a bad day, check this out. All right, let's just keep it real. Okay, we're talking about having a bad day. COVID-19 has absolutely changed life as we know it. Who can agree with that? I mean, like just looking at this chart, COVID-19 is like the barrier between you and other people now. Like everybody is worried about giving it to each other or getting it. It's like every time you go outside and you see somebody wearing a mask, you are reminded that COVID-19 exists. And even in the house, when you come back into the house, I have a newborn and I come back into the house, I'm like, oh my goodness, the baby, I have to protect my baby. And so you're thinking constantly about protecting your family, you're sending your kids out to school, hoping that they don't come back with COVID-19. It's just super stressful, right? It's super stressful to be during this time. Am I the only one that is just like, I just have COVID fatigue. I'm tired. I'm tired of it. I'm tired. I'm just fatigued, right? And I'm looking at it as an instructor, a mother, a daughter, a granddaughter, just like all these things that I have to be thinking about when it comes to COVID-19. And you guys, for sure, nursing students, let me show you the changes that COVID-19 how it has affected nursing students, because I can show you nursing, but you guys are in still the role of the nursing student right now. And so let me show you so many changes. So many changes. So if you're a nursing student right now, let me say, I'm so over this mess. Yes. If you're a nursing student right now, what's happening? Schools are changing. Okay. They're trying to offer more online and distance learning programs. All right. Everybody's trying to move to online when it comes to nursing school. It's very difficult. Listen, the days of sitting in a classroom with 400 people, until this vaccine drops is non-existent. All right. So nursing programs, they're limited. They can't take as many students. It was already very competitive to get into nursing school. Now, because of the clinical placement situations, it's even more difficult to have large groups of new entry nurses to come in. It's very tough. All right. No more right now are you able to tour nursing schools. They're not really doing tours of nursing schools or laboratory facilities like they used to. And so again, the nursing programs are very competitive. Many clinical rotations and clinical sites have been canceled because the hospitals, they don't want the chance of new nurses coming in. Patients don't want extra people in their room. You can hardly have visitors. If I can't have my kids come and visit me while I'm in the hospital, I don't want random nursing students coming in to visit me. And that's just the sentiment of people. So it's very difficult now to have clinical placements and, practice clinical simulations in a real hospital environment because everything is so locked down, super stressful. Okay. Nursing students right now are dealing with this. And so again, a lot of senior nursing students last year could not even graduate because they lost their ability to finish their clinicals. So they're delayed, or the schools didn't have the ability to train them for the last semester. And we were grateful for all the nursing schools that put their students in the virtual trainer for the last semester. Also, hey, what about this? After you graduate and get a license, are there going to be jobs for you? It could be very challenging to get a job if hospitals are not hiring because of COVID. And hopefully this won't be the case. I'm still getting text messages and things like that from jobs every day. So I don't know. I mean, this was reported that jobs could be limited if hospitals are hiring on a hiring freeze, or also there can be an increase in telehealth jobs or distance evaluation jobs. And those are not jobs typically for new graduates. You have to have experience to do those type of positions. And so as a nursing student, these are the challenges that COVID has presented. On top of, God forbid, any of us get COVID and have to deal with the health challenges of having this condition. All right. So is this a bad day though? Like all the stuff that's going on, what is a bad day? And this is very, it's very important to consider, because even though we have all this going on, is this really a bad day? All right. And I would like to present this, and this is a graphic I just drummed up this little graphic, and I said, a bad day is losing a loved one. Okay. A bad day is losing somebody you love. All right. Or they pass away. All right. I've Remar nurses that have lost parents, that have lost grandparents, people that were significant to them. All right. A car accident. You get into a car accident, there's nothing that can derail your day more than a car accident, right? Am I right? All right. Or you losing your home. You're homeless. All right. You don't know where you're going to lay your head at night. That's a bad day. All right. What's not a bad day are these NCLEX related things. Okay. So missing a practice question. Some of you guys are beating yourself up because you miss a practice question when you come and study. You know, you're kicking yourself. You're not wanting to test. I see it all the time in our study groups on the comments. You get a practice question wrong. Your whole day is shot. You don't feel like you can take it. Listen, you don't feel like you can take the NCLEX exam. You call yourself stupid. You say, I can't do this. I missed that delegation question. I'm not ready for NCLEX. You guys got to stop that. Okay. Missing practice questions is not a bad day. All right. Having anxiety. All right. This is not a bad day as well. And this is somebody who I used to have panic attacks in nursing school. I struggled with panic attacks terribly. All right. It was something that I never thought I could overcome. And so that's why when I started doing my NCLEX review, I was like, we got to deal with the anxiety, because anxiety will paralyze you. So even us who deal with anxiety, you're dealing with it. I want you to continue to acknowledge it's there. I don't want you to let it take you totally off track of your goals. That's not a bad day. All right. You can overcome anxiety. Like, by God's grace, I have not had an anxiety attack in over 12 years. Like, you can overcome it. All right. Not a bad day. Also, if your NCLEX exam has been changed, has been canceled, has been rescheduled, that is not a bad day. Okay. It sucks, but don't chalk up the whole day, your whole existence, and be down in the dumps and depressed because of that exam. All right. That change in your exam. These are all things that you want. These are all things that you're essentially blessed to be dealing with. All right. Because if those are the things that are happening to you, guess what? You have a lot to be grateful for. If these are the bad things that are happening to you right now, with everything that's going on, it's a good day. All right. Being in a position to even study and take this exam is a good day. Okay. All right. Listen. There are so many people who would love to be in your position right now, that would love to be doing the virtual trainer. People asking me, do you have virtual trainer for somebody that's not ever attended nursing school? I just want to get started. People just want to get into nursing. Can I start studying quick facts now? Like, people want to be in your position, the position that we are like, oh, this sucks. I have my test got rescheduled, or I can't test for another month. Like, no, like, You have a lot to be grateful for, all right? And the people that are dealing with the bad things that happen, like truly the bad things, losing people, losing their home, losing their car, those are the people that we need to be praying for. We need to be telling them, how can I help you? Not people that are missing practice questions, okay? You guys are good. You guys have a ministry to care for somebody else. And so I just want to remind you, I wanted to put things in perspective this week that Monday, it's a good day. It's a good day for most of us. And we have a goal that's right there. We've been showing this chart, and it's just the salary chart for nurses, right? It's just a salary chart for nurses and nursing instructors and the LPNs, right? These are, the entry salaries. And so this is motivation as well. All right. We want to be able to be paid for our knowledge. You guys are all millionaires, whether you know it or not. The knowledge that you have up here, the art, the science of nursing, there is a value to it that is immeasurable, right? You can go in and care. You can go in and administer medications. You can dress wounds and do therapeutic touch and calm people down, right? And so there is an exchange. There is a monetary exchange for what you have studied. And you're never going to be paid for what you're worth until you get your nursing license. And that's just the truth of the matter. Any other job that you're working, you're not being paid your worth if it's not in nursing, because you are extremely knowledgeable in a craft, all right? And this craft is in high demand. So unless you are getting job opportunities that are paying you $800, $900 a week, $1,000 a week, you are being underpaid for your services, okay? And a lot of us forget that. We forget that. And no, it's not all about the money. It's not all about the money at all, but it is about valuing the individual for what they're worth. And there's nothing wrong with that. There's nothing wrong with that. So I present to you your Monday motivation that if you're in a position to get a nursing license, it's a good day for you. All right. You are not without hope. You are not without a solution. All right. And so you guys are extremely valuable to me. I love you guys so much. Thank you for attending How to Pass NCLEX, your weekly motivation. Hey, your weekly motivation and your NCLEX questions. All right. So I just saw just a couple questions I want to address really quickly. Whew. All right. At the end of this program, the first one is, somebody said, how do you study quick facts? How do you study it? Okay. If you have the 5-star edition of this book, what I did for the updated version of this book is on page 5, the numeric page, I put in the study calendar. All right. And this study calendar is used for you to study the program the partial program, I should say. But it's used for you to pick one day out of the 3-week program to study. Okay. All right. So the topics are listed here. If you don't have the 5-star version, if you have the original version of this book, there is no calendar in that version. So you have to break it up, however you need to break it up. But this is a book that you can give to somebody and say, hey, do me a favor. Ask me about clinical skills, or ask me about Lyme disease. All right. Because these are all topics that you need to know for your exam. All right. And then you literally have the person ask you the question and you try to give them the answer. It's that simple. It's not paragraphs that you got to highlight or, fill in the blank. All the answers are there. It's quick facts. You got to know this book. Some people have it. They say they love it. They take it everywhere. And look how thin it is. Hey, you could take it everywhere. Put this in your purse. Put this in your Gucci bag. All right. And take it with you. All right. But remember that quick facts is just half of the program, because all of the other information that is not in quick facts, you got to know it. And it's in the VT workbook. Okay. So people ask me all the time, can I pass with just quick facts? No, not really. All right, because all of this information is in the VT workbook, and you still have to be responsible for all of these topics. So the topics that I don't go over in quick facts, which is like pregnancy, a lot of the clinical judgment, the age-specific nursing care, expected changes in aging, dieting, prioritization, psychiatric conditions, respiratory conditions. I don't go over that stuff in the quick facts book. All right, EKGs, legal issues, maternity. You got to know all that stuff for your exam. All right. Management of care, coordinated care. It all comes from this book. So if you get this plus this, bam, you put it together, infinity stone. All right. For NCLEX. This is the solution. This is the solution for passing NCLEX. These two together, plus me, plus you, and we have a nursing license. So let's continue to study. Some people said, oh, I got my quick facts on Saturday. I'm loving it. Yeah. Somebody said I ripped out the pages. Oh my goodness. You ripped out the pages of my book. All right. However you got to get it in, flashcards, whatever. I got you. All right. Is there a difference between the 5-star and the original? Yes, there is. It's not just a study calendar. The 5-star has all the updated information, plus it has 19 new topics, plus the clinical skills section. And I redid the pharmacology section. The Quick Facts book, you guys know, has, and you need to have all this memorized. This is not a book that you can't memorize. The pharmacology section in this book, I redid it and I took out all of the trade names. And so it's only generic names, which, you have to know for the exam, the generic names. So, hey, somebody says, can I just purchase the virtual trainer? I have the old DVD version. Yeah, you can purchase the virtual trainer. Check out remarnurse.com. The VT is definitely an upgrade from the DVD version. There are topics. I go more in depth than on the DVDs. I love those DVDs, but they really needed to be re-recorded and redone. All right. Jessica says, I love the VT. I'm taking my last class. It's so useful. I like that. I like that definition. It's so useful. All right. I have the quick facts. Hi, Regina. All right. Okay. Another question is about people were asking me about the question bank. I love the question bank too, but you do the question bank after this. Don't try to do that question bank before doing these two. All right. Because it's challenging. I know the question bank is tough. Check it out at remarnurse.com. The price for the question bank is only $29. It's an online question bank. All right. Do you recommend we put everything on flashcards from the virtual trainer? No, I don't recommend that, because remember with the virtual trainer, when I'm studying the virtual trainer, I take most of my notes actually in the book. So I'm not needing to make a flashcard of something I've already written down, because I would have written it down twice. Now, some people are writers. That's how they learn, by writing things down. But I am not that type of writer learner. I only need to write it down one time and then I read it. But if you need to write it down in here and make flashcards, then you do that. I only would make flashcards on things that I am not really secure in. So for example, people make flashcards of this book because you're not writing anything down. So there may be a section in here, maybe in pharmacology, where you need to memorize the side effects of opioid drugs, all right? Or laboratory values. I had to make flashcards for laboratory values because I just could not remember those numbers, right? They just didn't stick with me, especially the ones for like albumin. Like, it took me a long time to do laboratory values for some reason, all right? Let me see here. VT is very good. I'm enjoying it. How much is VT now? All right. So go to the website, remarnurse.com, and then you can look at virtual trainer prices right now. Plus, if you have quick facts, if you don't have quick facts, I just don't want to say the wrong number because I don't have all of the adjustments memorized. Okay. What else are we saying about that? I like the VT videos, short and precise. Yes. And remember, with those VT videos, you can speed them up or slow them down however you want to. All right. Why the people who purchase both books don't get a free question bank? Okay. Well, the reason is why. That's a great question. The reason is why is because all of the products that I do, I've put a lot of work and time into them. And so I already give you guys tons of free information. Nobody does more free information from Remar. Nobody comes on here every week besides me to do motivations, NCLEX questions, scary topics, 7 days of NCLEX, maternity and pregnancy, love your content. Nobody else is doing that. And so people always impose more. They always say, give us more stuff for free. I should get this for free because I did that. And that's just not the exchange of value of my time. Because every time that I'm on here with you guys, I'm not with my children. I'm not with my husband. I'm not with my mother, you know? And so I don't see people imposing that type of standard on other companies. I don't see people saying, you will give us this question bank for free, but they do it to me. I don't know why. Why is that? I could think of some things why they do it to me, but I don't know. So no, everything that I put into what I do is a value of me. And I already do it for the lowest price. There is no other question bank that's $29. My question bank is literally starting at $29 and people demand that it's for free. Why is that? Why is that? I don't know. You let me know. So I appreciate you guys and I value you guys, but I want you to value my time and what I do for you as well. Even exchange, right? Okay. All right. So let's see. Can you do scary topics again? Scary topics was so much fun. Scary topics was it was the free event that we did last month. I told you guys once we did that video, we were going to take it down, right? So no, I can't do it. It's a one-time event for the year, but Black Friday is coming up. Let me tell you, if you loved Black Friday, I mean, if you love scary topics, you're going to love Black Friday, because Black Friday, we do like the whole day is literally NCLEX review. And so we will be going over quick facts. We'll be going over the virtual trainer. There's a workbook for Black Friday. So please, please, please go to remarnurse.com, sign up so you can get that workbook. And we're going to be just studying all day on Black Friday. And my goal is to keep you from shopping. It's very hard to do. It's very hard to do because people already started their Black Friday sales. I know you're shopping. I know you're shopping for Black Friday, but I'm going to try to make it so on the actual Black Friday, you're home. All right, studying with me. So sign up for it. All right, guys. Yes, please, Black Friday again. All right. Okay. All right. The program is challenging. I'm telling you guys, I do see the comments that yes, the virtual trainer is challenging. It's not something you've probably ever done before. I have not seen an NCLEX review like it before, but I'm telling you, for all the work that you put into yourself, at the end of it, you will feel so much better with your content. I promise you that. All right. So what I want you guys to do, hop off here, go over to remarnurse.com. Make sure I have your email because I'll be going live again this week. I don't know what day it is. I just popped up Saturday night at it was like 10 o'clock Saturday night and we did NCLEX questions and it was so much fun. Kathy, you did it with me. So I want to do that with you guys again this week. And then we're preparing for Black Friday. So people want to know about, the pricing, what I'll be offering, what we will be doing. Sign up for it. Hey, we did it. How to pass NCLEX. Yes. All right. I'll see you guys later. Bye-bye.